Dear patient mom, especially mothers that have a child with this type of eyes, this video is for you because I'm going to be telling you about a home remedy you can be practicing at home with your child, which can help to improve how your child looks at things. Instead of the eye falling off, looking this way, upward, downward, or even rotating while your child is looking at something straight ahead. Of course, you people are familiar with this type of eyes, the one you call Anya Harper's or 430 eye. This type of eye is medically known as tropia or strabismus. Basically, there are three methods of correcting or managing this type of eyes. Number one is the use of corrective lenses. This is because most of these children with this type of eyes usually develop myopia or hyperopia. So we correct using corrective lenses. Apart from that, we also send this patient to an optometrist. Yes, you are not familiar with this name. These are type of eye doctors that specializes in managing specifically this type of eye, where they use different type of vision therapies to train the patient's eye to learn how to coordinate while looking at things. The third method is that we send this patient for surgery. That's for people that are very buoyant. During the surgery, what the surgeon usually do is that they sleeve the longer eye muscle, because this problem is as a result of eye muscle imbalance. So one of the muscles is longer than one. So that's why you see it's either it's moving, the eye is moving this way, or it's moving towards the nose, or it's going up, or it's going down. So anyone that is causing the problem during the surgical procedure, they sleeve it, suture it back so that it will align. So let's say your child have not gone for this surgery but has this type of eyes. Even if your child is wearing eyeglasses already, this is something you can be doing to improve the way your child looks at things. So at home, you're going to get a pen. For those that are below 5, you can get colorful pens so that it will help them to concentrate because of the color. So the distance between you and your child or your toddler is going to be from where you're standing and here. So we are using this as the measurement for the distance. Because your child is going to be shorter than you, of course, as the mother or the father that is doing this test, you and your child have to be seated so that two people can be at the same eye level. While two of you are seated, you're going to use this pen and tell your child, baby, I want you to be looking at the tip of this pen. So you tell your child, I'm going to bring this pen close to your nose. Don't move your head. Don't move any other part of your body. Only your eyes should move. If this pen is coming close to you, keep looking at it. Your focus should be on the tip of the pen. You tell your child that while you are bringing this pen closer to his or her nose, that this pen is going to appear double. He or she should tell him when this pen appeared double. So once your child said, Mommy, this pen is now appearing two or double in my eyes, you stop. You go back and continue. Let's say this is you and I'm your child. So you're going to move this pen like this. The pen is not even appearing to. Are you sure my own eye is okay? So this is basically the therapy. This is called the pencil push-up therapy, and that helps to strengthen the eye muscle, especially for babies or toddlers whose eyes always move outward when they are reading, pressing their tablets, and their eyes, one of the eyes always falling off. This can help to strengthen or improve the pattern of gaze. People that are always on their computer, reading, doing anything that has to do with closeness to the eyes, this is because occasionally they can have eye strain or eye pain. So this can actually ease the eye strain. You can actually do this exercise for your child up to 20 to 30 times per day, due to the fact that most toddlers or children have short span of attention. You can divide this in 3 sections: 10 morning, 10 afternoon, 10 in the evening. And I need to remind you that this is not magic. You need to be patient and consistent in order to see results.